Good morning. I'm very happy to be here. I'm going to be taking a bit of a different perspective, leveraging some of my global experiences and lessons learned and how that can be applied here in Edmonton. So I believe that our ecosystem here in Alberta, particularly in Canada, needs to be more agile, more nimble, being proactive and responding to change, creating an environment and an ecosystem and a culture of change. I think Reg mentioned earlier in his opening remarks that we need to be proactive rather than reactive. And I think it's also true what they say, that culture eats strategy for breakfast. Our healthcare system needs to breed culture of change, who we are and what we do, where change is not feared but embraced. And change champions can become those role models and catalysts for desired change. And I truly believe that Health City is an innovative disruptor, and they're actually creating that culture of change that we so desperately need here in Alberta. A personal example that I wanted to shed some light, and I had the opportunity to work in East Africa, particularly in Kenya. Kenya is a very interesting place. It's the tech hub of East Africa, characterized as such. Openness to innovative change, new technologies, building that culture of change. And what we had was, at the time, I was working in an urban slum in Kenya called Kibera. Kibera is arguably the largest slum in Africa. Estimates of 1 million people, very densely populated environment, over 100 clinics. And it wasn't the fact that health infrastructure was a problem, it was interoperability between these clinics was an issue, which we see here in Alberta. And the reason why I'm highlighting this example, because we faced very similar challenges that we face here. It's universal across the board when you're implementing health information systems. So we worked with clinics to implement an open source innovative technology in clinics in Kibera. And we were able to do that with with implementing partners on the ground. And we faced various challenges such as adoption, training, change management. And we realized that the technology wasn't the issue. You can have all the bells and whistles of a technology, but if you don't really understand what the needs are on the ground and what clinics need, clinicians, and most importantly, the frontline staff that use this on a daily basis, your technology uptake will be dismal and it will fail. And so what we also realized is that open source technology was the way to go because proprietary software at the time, and due to very limited budget constraints, wasn't a feasible option. And so what I wanted to do is leave you with some key lessons learned. One is building that culture of change, something that's important for large care, healthcare, and technology transformation projects. I think we heard from Corey earlier about the connections and making sure you're building powerful alliances within the ecosystem, working towards a common goal so that we can all be successful. We can't do this alone, and I think we're hearing that time and time again. I was at Singularity University Exponential Medicine conference in November, and that was something that was widely recognized across private and the public sector. We really do need partnerships across the board to be successful. Two is be open about our failures. I think this is something we shy away from sometimes, particularly on projects. It's okay to share those failures, and it's important to do so that we can learn from each other. We work with very different clients across the board globally, and our advice is, if you fail fast and pivot. So learn from your mistakes, do it quickly, and pivot your approach, because you'll realize that you're able to build off of that and hopefully have a different and more of a successful outcome. And finally, technology sometimes is used as the be-all, end-all, and the focal point of some of these implementations. And what we've seen is that technology should be an enabler to improve patient outcomes. We're seeing a lot of AI, ML, blockchain, IoT, a lot of these buzzwords within the healthcare space. How do we leverage it? Don't focus specifically on the technology. I think technology is one piece of the grand puzzle. but rather we need to focus on some of these key areas that are neglected, which is the people side of things, the training, the change management, adoption, and user engagement. I think that's something we need to really make sure that we're leveraging some of the stakeholders, making sure we're gathering the proper input and expertise required to make these implementations successful. And finally, I think we need to change for and with the ecosystem and really come together as a collective community.